Hi, welcome to my channel. Thanks for tuning in. My name is RMT Randy. I am a registered massage therapist in Alberta, Canada, and this video is primarily to share the techniques, the tips, and the tricks that I have shared with my clientele in treatment so that they can reference it again later. If you have stumbled upon this video and you want to try these stretches, please check in with your doctor and use your discretion. When in doubt, go see a doctor or go get some treatment from a massage therapist that is accredited in your area, and see if they can help you out with whatever's going on with your neck. So a lot of people have neck issues and they work at the desk, they work at the computer. But lots of people do other kind of work that isn't desk or computer based and have neck issues. Some people have chronic neck issues. It's pretty much just the human neck is the way it is, and it pretty much always needs some kind of maintenance. So this is some of the information I have. I do have a video on bolstering for sleep posture that you can check out if you're so interested. Particularly for side sleepers, you want to make sure that your shoulder is not up on a pillow and that the pillows are right under your head and neck instead of under your body. And too many pillows and too few pillows can really skew the neck up or down. And that can be like a leading cause of waking up and being like, what's going on with my neck? But so can stress. So, life does happen and the human experience continues to be experienced by us all and by our necks. So let's get into it. This video has some examples of me doing all the motions, which I'm going to voice over. And so here's just some information about what those images are going to be. So first I'm going to go through something called line isometrics. An isometric is a exercise or a stretch or a movement or something that you get your muscles to do where you get the muscle to completely load up, but you don't make it move through space whatsoever. So we're not moving our head and our neck a lot. We're just trying to power up the muscles that would do that. And I'll go over that more when we get to that spot. The alternative to an isometric is an isotonic, and how I remember the difference and how I remembered in school the difference between an isometric and an isotonic and which one has the movement is that a tonic, like a potion, changes you. So that's how I remember. And I call these line isometrics because I would like you to do them lying down. As soon as you are sitting up or standing up, all the neck muscles are working. They're working to hold your neck up against gravity and to look around and to be alert. So if you can lay down and have the muscles in as a relaxed as position as possible, I feel like that goes further. As well, when I do these stretches with people, they usually come in to get a massage and they booked specifically because their neck is bothering them. They can't shoulder check or there's just a lot of tension, there's a lot of pain, and they want it dealt with. So if someone is really having a hard time, I'll lay them down on the table and we will do these line isometrics. I'll explain what I'm doing just as I'm going to in this video. And instead of having them be their own resistance, I resist for them. So this is how I have developed from my time at school and what I learned of anatomy and the range of motion and what muscles do what in the neck. This is what I have developed to try and give people like a number one base of response. You wake up and your neck is messed up. You can try these line isometrics right in bed and see if that does anything for you. You do not want to continue with them if they worsen, if you have apprehension, if you have any sharp shooting pain or any numbness, tingling, like something's falling asleep. So if any of that is happening, please go to a doctor. But if you wake up and your neck is just kind of stiff and you are able to go through these line isometrics, then that might be something for you to do more regularly before or after bed, before you go to bed or when you wake up, even when your neck isn't sore, just to maintain that mobility and have a bit of a maintenance schedule with your neck. Then I'm going to be going into a standing or like sit up, like if you can do this in your office chair, some neck mobility and posture reset movements that I favor. So we'll go over those in the video. And then finally, something called the SEM pinch. So the main muscle that's in the front of your neck, the two cords on the either side of your neck that help bend the neck forward, but also help turn and flex the neck to the side, is called the SEM. It's called the sternocleidomastoid because it attaches to the sternum and the clavicle and the mastoid process, which are all bones around the neck and the head. And so we shorten it to the SEM. And the SEM pinch is a simple, really gentle, keyword gentle maneuver that you can do to try and relax that muscle, especially if you wake up with torticollis or TOS, where the head is a bit tilted because of one muscle shortening generally when you sleep poorly. So this is called a muscle approximation. It's where you take the two ends of a muscle on either side of where they attach to bone and you gently bring them together, which helps release knots that are stuck in the muscle. Okay, let's get into the examples. Okay, first up in our line isometric, you're going to push your head into the floor. You're just going to drive it right back. You're not going to raise up the chin. You're going to keep it into like a bit of a double chin, and that's totally fine. Keep the jaw loose, easy breathing. If this is starting to strain the low back, then you can put your feet flat on the floor and raise your knees. And then you're going to relax and now push back again, but maybe from a different spot on the face, maybe from the chin or the nose. And this is to target different muscle groups. So you can do this a few times and you can choose different areas. My lips are closed, but my teeth are not touching, so keep the jaw loose. And that's for going backward. Going forward, we're going to mimic this motion where you look up, but we're going to maintain like a friction point. So you're going to put your fingers in your cheekbones, and you're not going to lift so hard or push so hard that that's really uncomfortable, but you want to reach this friction point where you really power up the front of the neck muscles, and then you can relax. So now we have done opposing muscles, the ones that go back and the ones that go forward, so hopefully they have relaxed a little bit. And now I'm just showing the motions that the neck can do. We can do lateral rotations, which is where we look over each shoulder, and we can do lateral flexion, which is where we tilt ear to shoulder. So now what we want to do is a little bit of a resistance point. So I'm going to look over my left shoulder, so I have to place my hand so that I can resist that, and then I'm going to push with my head and pull with my hand. Now I'm not moving with so much force so that my head actually moves. I'm maintaining that friction point and keeping it an isometric where we don't move. And I'm keeping my jaw loose and I'm just feeling all those muscles really pop up. So again, I'm going to turn over the right shoulder. I need to position my hand to resist that appropriately. I have been experiencing quite a bit of tension in the right side of my posterior neck or the back of my neck, so I'm just bringing in my other hand to help with this resistance because it was feeling quite tense. And then I'm going to relax. And now we're going to go into our lateral flexions where we go ear to shoulder. So I'm going to put the hand over the top of the head and pull down. Again, I'm not pulling all the way down. I'm maintaining that friction point and just letting the muscles really juice up and talk to me. Yeah, right in the shoulder here. And we don't want to raise the shoulder to the ear. We're just trying to lower the ear to the shoulder. So we relax and then we switch sides. Here I feel like I moved a little bit too much, so I'm just coming a little bit back to neutral. Really feeling it in the corner of the neck there. And then relax. Do some shoulder movements. Doing some shrugs, some like samba shoulder rolls is a really nice way to keep that corner of the neck and shoulder mobile and to keep connection with it so you know what's going on. Now I'm just doing some light mobility here on the floor. I'm going to do this again when I'm seated up, but this is nice because the neck muscles don't actually have to help keep my head up. I can just check in and really see if these isometrics have improved my neck condition at all or not. And then just doing some gentle ROM, some range of motion, is just a nice way to maintain mobility. So now we're going to talk about having like that forward head posture and how throughout the day we try to correct and bring it back, and it just is not going to work because your muscles are fighting each other. So the head is forward. Let's really bring it forward. Let's really stretch it forward. We're going to open the jaw because we're not going to clench. This should feel good. You're really letting the front neck muscles pull you forward and then feeling it wherever you feel it. I'm feeling it in the back of my neck and in the front of my neck. And then maybe you'll find that some muscles relax and then you can stretch even further, or it might feel nice to really bring the shoulders up and back. Whatever feels good here, it should not feel bad, but maintain it and breathe really deeply, really gently. And then when you come out of it, you're going to relax into a much more neutral position, a lot more effortlessly than trying to get yourself into it. Similarly, we're going to bring the shoulders right up to the ears instead of trying to get them to go down. And then I like to bring the arms up and start to move my head in flexion and extension or forward and back, just to kind of show and prove to myself that I can still be mobile even when my shoulders are jacked way up to heaven. And then we can do a reverse shrug. So after bringing the shoulders up, you let them fall. After doing a reverse shrug, you just let them come back up. Now we're going to look at neck mobility, and we do not want to be swinging from side to side because it's two different sets of muscles and it's just stressful. So we want to look over our shoulder and then let the neck relax back to neutral. You can do as many as you want. You can do 3, you can do 5, you can do 15, I don't care. But we're going to look over each shoulder a few times and then returning neutral to center. Don't swing side to side. And then we can do our lateral flexion, which is a tilt ear to shoulder. Again, 3 to 5 each side, I think is what I'm trying to do here. The jaw is loose. I am not feeling too much pain anywhere. I do have tension over on this right hand side. So you can see my shoulders trying to come up and help a little bit. And like we just work with where we're at. Now I'm going to do some flexion. I'm going to look down to my chest, maybe bring the forehead to the chest, and then create a big C with the front of my body. I'm going to do an extension, really bring the crown of the head to the middle of the back, and then a big C with the back of my body. Let's get some shoulders in there, some shrugs, maybe some rolls. And now that we've warmed up this whole area, now it is appropriate to do neck rolls. If you just roll right into a neck roll without doing any of the other mobility, if you are stiff, it might catch you off guard and it might, shock you into like, oh, and now you're even more stiff. Now let's get into the SCM pinch. So let's say you wake up and your neck is a little bit messed up. You're going to want to grab really gently under the ear and at the base of the throat, the two ends of this big muscle at the front of the neck. And this muscle is going to pop into your fingers if you turn your head and relax your head to the direction you're trying to grab. You gently grab the muscles and then you mush your hands together without changing your grip, which is incredibly gentle. And the muscle should just relax and slip out of your fingers. And this is another at-home way to try and reset your neck. Go see a massage therapist and ask them to teach you this muscle approximation if you tend to have a bum neck. Okay, thanks.